All right, so we are going to spend the next little while working on lab material. I'll show you where to find our lab stuff. There are two different ways for us to access our lab resources. First way we can get to our lab resources is if you scroll down on your homepage. This is what it looks like when we first log in. There is a place right here that says click here to access learning materials. So the first way I can get to my stuff for the class is to click here. When I click here, it's going to take me to what's called the modules area of the course. So the other way to get to your resources is right here on the left side by clicking modules. So when we talk about lab, there are a couple of different kinds of resources available for you that are important this week. So the first thing you see here at the top of our modules section is some general lab information. So make sure to take some time to review our lab syllabus. It kind of has a breakdown of the way that we do grading in this class. So your lab grade is 30% of your overall grade in the course. The rest of it comes from lecture. We've got a couple of exams, quite a few quizzes, lots of homework to prepare you for the quizzes. The syllabus will break down for you what all we're doing to get our grades in the class. What would be helpful for you to download and possibly print is our lab schedule. So this shows you that here we are in week 1. We are covering lesson number 1. Notice that in week number 2, we're covering a different lesson, lesson number 2. We're also taking our first quiz. For you to be able to take online quizzes at home and not in class, you do need to have access to a webcam. So if you don't have access to a webcam, reach out to me. We'll figure out how we're going to address that. For the most part, we're going to do a lot of our labs in person because we need the microscope, because of the quizzing. But to be prepared, if you have access to a webcam or a computer that has a webcam built in, you should be set. So our first quiz is next week. It's going to cover our content from this week, which is the lesson number 1 packet. Our first lab exam, we have 2 of them, will be the week of February 28th, and that's going to cover all of the content from the first 6 weeks of class. Everything after the midterm exam will be covered on our final exam that we take the week before finals week. So this schedule shows you what you should be covering each week for our lab classes. So I'm going to go back to modules. That was our weekly schedule. If you download the lab manual that's up here, this includes all of the worksheets we'll be using all semester. So if you want to download and print everything all at once, that's for you right here. If you'd rather do it week by week, I've posted those week by week for you as well. One of the things we'll be using in addition to Canvas for our course is something called Visible Body. And this is an online dissection-based software. You get 2 weeks of free access to Visible Body to get used to it, to start working in it. At the end of 2 weeks, you'll need to pay for it. It's $50. That access will last you for a year inside the course. And there are also apps that you can download that you have forever. So when you move on to nursing school, dental hygiene, sonography, whatever it is that you're headed toward, you would still have those apps if you download them. So that's Visible Body. The first time you log in to Visible Body, you need to get to it through this point right here. We need to register for the class. Once you've registered, every other week, there'll be a link down in the module that you can click to and go straight to where you need to be. So let's say you've taken care of all of these things here on the list. I no longer need to see this information. This little arrow right here next to the skull, when I click on it, it changes the direction and this information is gone. You're definitely going to want to be hiding modules all semester because there are a lot of modules coming your way. So once you've looked through the lab information, hide it. We're good. I'm going to skip the lecture one for right now because we'll cover it more during our lecture class. I'm going to jump here into lab week 1. So each week you will see a worksheet available for you. Again, if you download and print that lab manual, it has all of the worksheets in it. The next thing you'll see is what's called the online guided lesson. The online guided lesson is a great resource for you because it helps you to complete your lesson worksheets. So you'll see today as we start working on things, the first thing we're talking about is the functions of different organ systems. So here's a page for exercise number 1, the organ systems of the body, describing their functions. Then we move on to exercise number 2, where we start to identify different organs. So it includes videos that walk through these models. It includes pictures that have labels on them, like what you're labeling. So these guided lessons are going to be an invaluable tool for you to help you as you're filling in your lab sheets. So let me go back. Download and print our worksheet. Use this as a reference to help you fill things in. Once your worksheet is complete and you feel okay about the material, then we're going to want to jump into our homework assignments for each week. Here at the beginning of the semester, we're probably going to have 2 homework assignments each week. As we get a little farther into the semester after the midterm exam, we might have more like 3 or 4. It just depends on the amount of content that we're covering each week. So we can see here the 2 assignments that we have to do for this week. For those of you who are normally in a Wednesday lab, your homework assignments for lab will always be due Tuesday night at 11:59. So right before you come to class, this is what you'll have to get done. For my friends who are in the Monday lab section, generally your lab assignments will be due Sunday nights. So the night before you come to take your quiz, you will need to complete those homework assignments. The same goes for visible body as well. Remember that we sign up at the top, but then each week you'll see a link after that that tells you how many assignments to expect that week in visible body. So your grade in the course is going to come from these assignments, as well as the visible body assignments, the quizzes that we take, as well as those exams that we're completing. I want to take a moment. I'm going to check out my chat. If you have questions, feel free to type those in. Let's take a peek and see if I can find it. Any questions or thoughts that we have? Or if you have nothing that you'd like to share, shoot me an emoji. How are we feeling so far? Lisa asked if attendance is mandatory. Yes, we do need to be attending each time. We're going to be completing group activities during our lab times. You have to be present to get credit for those. Lab coats are not provided. We do not actually do many things where you'd need a lab coat. When we dissect an eyeball and dissect a brain at the end of the semester, you may want to bring your own or just wear some old clothes. But other than that, you won't really need a lab coat. So the first visible body assignments, if you are in a Wednesday lab class, that is correct. Your first visible body assignments will be due next Tuesday. If you are normally in a Monday lab class, your first assignment will be due Sunday night. So make sure to log in, get started with that, so you have those done. Laura asked about books. There are no books required for our course. You have the guided lessons. Apologies, let me get everyone in here. You've got those guided lessons that kind of sub for your textbook. If you would like one, you're welcome to still have one. We are struggling, but there is not one required for our course. Let's see. No need to wear scrubs. If you want to, you're welcome to, but not required. Kayla, when will we actually come to campus? It will either be next week or definitely by week 3. So it's just going to vary a little bit based on the content that we're covering. Some things we have to be in the lab for, some things we don't. We're a blended class, so we're going to kind of play it by ear, and I will make sure that you know by Friday of each week what we're doing. If you weren't able to print notes for today, or if you're not able to print notes any day, that's totally fine. Just take notes on a different piece of paper. Every semester when I ask my students what is the most helpful for them when they are doing this class, they always say that the notes outlines for lecture and lab are the #1 thing. So always do your best to try to get those printed and distributed. So that you have them when you come to class. But if you don't have them one week, that's not a big deal. Let's see. Valerie, if you have an A&P book, you're welcome to hold on to it. I'm not going to assign you any readings. So Valerie asked if we had another textbook, would it be useful? It might be, if you want another resource. So I'm not gonna say no, but you don't need it, put it that way. So Alexis asked if we have the things on our computer, can we take notes on them? Yes, although I am not fully wise in this. Help me out. My students know about various ways that you can edit PDFs on your computer. If you are someone who knows how to do that, can you help out your friend Alexis in the notes? I know there's free programs out there to do it because my students do it all the time. I just don't remember their names. So Alexis, see if you can, hopefully someone has some ideas for you of how to edit those PDFs. I know it can be done because I have students that save into virtual notebooks all the time. I just don't know how to do it. And Alyssa asked about review sessions. Yeah, we have some built into our calendar. We will have some time to review, and there are also a lot of review resources available for you as well. All right. I got lots of words, not nearly enough emojis. Before I move on, send me an emoji. How are we feeling about our course structure? What do you think? Laura's giggling at me. I'll take it. It's all good. Love it. Okay. Yeah, the crazy face. I had a friend, let me see if, I don't know. Yeah, they don't have one in here. Ooh, goodness. Full disclosure, I am very good at doing class online in Collaborate. Yeah, they don't have it here, which was the Blackboard thing. If you remember back when we were online, we were still using Blackboard. So I'm really good at doing virtual classes in Oh, she found it. Elena's found it for me. I'm really good at Blackboard classes, but we're not in Blackboard anymore. So I'm going to do my best to make it run. I love it though. Perfect. Alyssa, this is our path to get money, right? Passing anatomy brings all the money. All right. Well, let's go ahead and dive in. I love it. That's a perfect note for us to dive in on, Halston. Yes, let's do it. All right. So I'm going to pull up this week's lab worksheet. Be behind the curtain of Dr. Allis's world. That's the group work. All right, here we go. Each of the lab sheets that you are completing this semester will always start off with a list of learning objectives. Consider those learning objectives your study guide. So when you get to the end of doing your lab work, when you get to the end of studying for the week, you should be able to do these things. So it's going to be for lab a lot of things like identifying things or listing or labeling things. These are the kind of learning objectives that you can just memorize your way through. Where if I can look at a picture, I can study a picture, and I should be good. When we get to lecture, I'm going to point out to you that I use a lot more terminology like describe or explain. With those things, you're going to have to do more than just memorize that information. But the good news is studying for lab should be easier in that regard. We're memorizing a lot of stuff. Since you have that guided lesson that I showed you earlier, I'm not going to go through all parts of this worksheet with you because I know that there are parts that you can complete on your own with those resources. So one of the things I'm not going to cover during our class time together is the functions of each of the organ systems in the body. I will mention, as we're thinking about the body, that the body has many different organs, and those organs all accomplish specific purposes. But having these specific purposes for the organs, they can't work by themselves. They need to work with their friends. So, for example, Dr. Allis will often say during our class time, I'll ask you about my favorite system. My favorite system is the system that breaks down food. So my favorite system is the digestive system. The reason that is my favorite system is because when I was in graduate school, I studied something called the gut-brain axis. And this is the idea that whatever's happening, excuse me, inside your digestive system can directly impact the way that you're thinking and feeling. So if you have a bacterial infection in your digestive tract, or if your digestive tract is unsettled, that influences the way that your brain feels or the way that your brain works. If everything's normal, that works normally as well. So my favorite system, the digestive system, the function of the digestive system, breaking down food. When we consider other organ systems in the body, they would work together with the digestive system to get things done. So, for example, when we break down food, when we start to absorb that food has to go into our circulation. So, we're going to use the cardiovascular system to transport blood, which is going to have nutrients in it throughout our body. Or we're going to use the urinary system to get rid of our waste products. Our organ systems work together to help us do big, important functions. So, like I mentioned, I'm not going to go through all of these. You can use the guided lesson. You can use Google. Use whatever is available to you. I don't care. Make sure we can describe the functions of our different organ systems. What I do want to take some time doing with you is labeling the different organs that we see on our organ models. So when I look at this image of a torso model, it's a little bit different than the torso model we have in the lab, but the organs that I see here are not any different, and the organ systems are not any different. So we're going to use this image to help us start to identify what our different organs look like. So let's get typing here. Starting at the top of our model, when we're looking in the neck on this model, we see an organ that's called the trachea. Your trachea is in the very front of your throat. The way I like to remember that the trachea is there is if someone is having trouble breathing, a doctor can cut the front of their throat and insert a breathing tube right in. The trachea is here on the very front side of the throat. Right behind the trachea, so imagine I took this guy and I looked at him from the side. Here's that trachea, the tube in the front. Right behind it is another tube. This is a smaller tube. That tube is called the esophagus. The esophagus. The esophagus is the tube that food goes down. The trachea, which I'll put a little X on here in the front, is the breathing tube. So esophagus in the back, trachea in the front. The trachea takes air down to our two lungs that we can see here. So the lungs, the two biggest organs in our respiratory system, That's where the process of gas exchange actually occurs to get that oxygen into our blood. In between the two lungs, we have the organ that's called the heart. The heart is nestled in between these two. It's a little bit more toward the left side than the right side. So the right lung is actually a little bit bigger than the left lung because the heart is there. Underneath the lung, you can see this little line. We've got a red arrow, excuse me, a yellow arrow here to this red line of tissue. This red line of tissue is an organ called the diaphragm. The diaphragm. The diaphragm is another part of the respiratory system. This is a muscle that when you take a deep breath and you kind of feel your chest cavity get bigger, the diaphragm is pulling down and making space for air to come into your chest cavity. So the diaphragm, primarily part of the respiratory system. It is technically a muscle as well, though. So some people would classify it as part of the muscular system as well. Right underneath the diaphragm is the largest internal organ in the body. This organ is the liver. So the liver is my large organ, part of the digestive system. In fact, most of the organs that we see down here in the abdominal pelvic cavity are all part of that system. So the liver helps to make something called bile. Bile helps you to break down fatty foods. Next door to the liver is the organ called the stomach, where food first goes into to start getting chopped up. Underneath or below the stomach, we have our two kinds of intestines. When we're trying to decide who's the large intestine versus the small intestine, it's not about the amount of space that they take up. It's about the size of the tube itself. So notice this wide tube that we see right here. This wide tube that we see right here is the large intestine. It's larger. The very small tubes that we have it squished all up in this area here, this is the small intestine. When you move into AMP2, you will talk about the specific parts of both the large intestine and the small intestine. The large intestine has a part called the ascending colon, the transverse colon, and the descending colon. The small intestine has some small parts called the ileum, the jejunum, and it's escaping me because it's been a little bit since I left. Let me see if I can I've got friends trying to get in. Okay. Duodenum, thank you. Yes, that is the small one that is the size of 10 fingers, the duodenum. Thank you. All right, so we've looked at all of the organs we can see up front. The other thing that we want to do as well, though, is imagine what it would look like if we took out these organs from the front and looked at the organs in the back of the abdominal pelvic cavity. When we look at those organs in the back, the first one that we see is this light brown one here. This light brown one here is called the spleen. Now, the spleen is kind of an odd organ when we think about classifying which organ system it's part of. We would say that the spleen is part of what's called the lymphatic system. The lymphatic system is the anatomy name for the immune system. So the lymphatic system is the system that the spleen is part of. Next to the spleen, down a bit that we see here, are the two kidney bean shaped organs called the kidneys. The kidneys, along with this organ we see down here in the very bottom of the abdominal pelvic cavity, which is the urinary bladder, these are both part of the urinary system. So the system that gets rid of our liquid waste, the urinary system with the urinary bladder and the kidneys. When you are working on your homework assignment, you will find that you have some questions that ask you to click on the part of the image that shows us the small intestine. Click on the part of the image that shows us the left lung. Here's a pro tip for you when you're working on those homework assignments. Do your best to click in the very middle of the organ or the structure that we're asking you for, because we went in and circled those organs. If you click close to the outside of that organ, you may not get credit for that question. So if I ask you about the small intestine, do me a favor and click here in the middle. Don't click right up here where it might be the small intestine or it might be the large intestine. I don't know for sure. You might not get credit for that. So find the middle of an organ, find the most prominent view of something. You should be good if you click in those places. Because we have so many organs in the body, we need to organize them into things that are called cavities. So as I'm looking at the organs of the body, recognize that they don't just sit there uncovered in the open. They're actually organized into physical spaces inside your chest and abdominal pelvic cavity. So let's start with the two biggest cavities that we have in the body, and then we'll break them down into smaller pieces that are perhaps more useful. The anatomy name for your chest cavity is the thoracic cavity. The thoracic cavity. So your thorax is your chest region, the thoracic cavity. Below the diaphragm, so this line right here is the diaphragm. Below that, we have what's called the abdominopelvic cavity. The abdominopelvic cavity. It's a really big, long name, but the name of that cavity is very descriptive because it tells me exactly what to call the other two cavities that are part of this. So the abdominal cavity is the top part of the abdominal pelvic cavity, where you might say is your abdomen, and down below it is the pelvic cavity. And the pelvic cavity is where we see things like the bladder, for example, or the uterus down in this lower part of the abdominal pelvic cavity. Just like the abdominal pelvic cavity could get split into two parts, the thoracic cavity can get split as well. So the first part of the thoracic cavity to mention are these two areas right here. These two areas right here, where we would find the lungs embedded inside of, are called the pleural cavity. The pleural cavity. So anything that includes pleura in it is always going to refer to the lungs. So we have two pleural cavities that are nestled inside the thoracic cavity. We also have the pericardial cavity. Pericardial literally means around the heart. So the pericardial cavity is the specific cavity that the heart lives inside of. But the heart is also technically part of the thoracic cavity, which is the big chest cavity that we see here. So when we talk about the organs of the body that we just labeled on the previous picture, you will often hear us ask you for the two body cavities that organs are found inside of. That's because we can be general and we can also be specific. So for example, when I'm talking about the heart, if I'm asking you for the general cavity that the heart's found in, is the heart found in the thoracic or the abdominopelvic cavity? Which general cavity would we say the heart is found inside of? Awesome. Yeah, several of us are chiming in. When we talk about the heart is found, its general cavity being the thoracic cavity. But we can also be specific with the heart to say exactly where it is in that cavity. And when we're specific about exactly where it is, that's when we get to say it's part of the pericardial cavity. The pericardial cavity. What would be the other organs from our list here that we would also say are part of the thoracic cavity? Who else lives in the thoracic cavity? Who else is up here with the heart? Exactly. Yep. The lungs are up there as well. So we would say that the lungs are also part of the thoracic cavity, but they have their own special place in the thoracic cavity. And their special place inside there is the pleural cavity, the pleural cavity. When we talk about the pleural cavity and the pericardial cavity, these two are divided from each other with different membranes. So they're physically divided. That's different from when we talk about the abdominal cavity and the pelvic cavity. Those are not physically divided from each other. So they're just kind of two slightly separate areas. Most of the stuff that you see when you look inside the abdominal pelvic cavity, most of that is part of the abdominal cavity. Our exceptions to that are things like the urinary bladder. So the urinary bladder is specifically in the pelvic cavity. I mentioned before as well that the uterus would be another thing in the pelvic cavity. Otherwise, when we're talking about things like the liver or the small intestine or the stomach, all of those would be considered part of the abdominal cavity. So most of the organs that we see in this area, abdominal cavity organs. But if we're way down here at the bottom, inside the bones of the pelvis, we're part of the pelvic cavity. Now let's do a hypothetical situation here. Let's say that I go to my doctor and I tell my doctor, yeah, so Victor is saying I keep trying to let this person in. I think you all can click admit as well. I think there's something wrong with their connection because I've tried to let them in several times. So do me a favor, if you see that message popping up on your screen, keep trying to let Angelit inside with us because I keep trying and it keeps not working. All right, so let's do a hypothetical situation. I go to my doctor and I tell my doctor that I have a problem in my thoracic cavity. If I tell my doctor I have a problem in my thoracic cavity, what organs am I having trouble with? What's in the thoracic cavity? Yeah, exactly. Several of us are chiming in. There's really only two options in the thoracic cavity. It's a problem with the heart, it's a problem with the lungs. Now, if I go to my doctor and I say I'm having a problem in my abdominopelvic cavity, rather than making you list all the organs that could have a problem, I think we can agree, right, that there's a lot. The abdominal pelvic cavity has many, many organs inside of it. So because the abdominal pelvic cavity is so large and has so many different organs inside of it, we actually split that cavity into what are called quadrants. So when we're talking about, yeah, it could be any of them, right? There's so many things in the abdominal pelvic cavity. So when we're talking about things that are found in the abdominal pelvic cavity, we are not just going to say that they're in the abdominal pelvic cavity. We're going to say what quadrant they're found in. When we talk about the quadrants, the good news is their names are super easy. It's the left lower quadrant, the left upper quadrant, right lower, right upper. It's very easy to name them. What can get a little bit tricky though is determining left versus right. Throughout our class together, there's going to be times where I tell you, hey, this is an underline highlight star idea. This is something that's really important. So whether you underline things, whether you highlight them or star them, whatever you do to help you remember that this is important, here's an idea that I want you to make sure to write down and highlight for yourself. This idea is that when we're deciding left or right, we have to put ourselves in our patient's shoes. Yeah, Jaquandra is completely right. To determine left side or right side, You can't use yourself. You can't look at the picture and say, oh, that's on my left side, so that's the patient's left side. That's on my right side, that's the patient's right side. You have to put yourself in the patient's shoes. So when we're looking at these quadrants, we have to keep in mind that it's their left or their right that matters, not ours. So with that in mind, help me out here. Here's my stomach. What quadrant is the stomach up here in? Would we say that this is left or right? Which side is this one up here?
It's the right quadrant.
Yeah, so we're referencing to anatomical position. And when we're in anatomical position, this is our patient's left side. In particular, this is my left upper quadrant because we're in the upper half of the picture. So remember, you're looking at the picture. If I turn around and I stand the way they're standing, when I am in their shoes, this is their left side. It's not my left side, it's their left side. Yeah, so Max is clarifying their left. So we would call this the left side, even though it's on the right side of the picture. Absolutely right. Exactly. Yeah, so a good way to think about it is think about your own organs. Absolutely. So put yourself in the patient's shoes or imagine it's on you. This is the left side, even though it's the right side of the picture, which means that this over here is going to be the right side. Even though it's on the left side of the picture, it's the right upper quadrant. So we figured out right and left, which makes the rest of this really easy, right? This one down here is my right lower quadrant, and this is my left lower quadrant. So we've labeled our quadrants. The reason quadrants are important is because they matter diagnostically. If I go to the emergency room and I say, oh man, I have left upper quadrant pain, left upper quadrant pain. What are some of the organs that my doctor might want to check out? If I've got left upper quadrant pain, what are we looking at? Yeah, the big one's the stomach, right? Hayden mentioned that didn't even know about the spleen until just now. Yeah, the spleen would be another option. The stomach and the spleen, two big ones that are here in our left upper quadrant. So the stomach, left upper quadrant, finding it up there. If I go in, maybe they think I have food poisoning, for example. They'll check it out. We'll see what goes with that. But if I go in and say I have right upper quadrant pain, what organs are most likely to be causing problems with right upper quadrant pain? What do we have there on the right side? Do we remember? Yeah, the liver's the big one. And Jessica honed in on the little green one right here. The little green one's called the gallbladder. The gallbladder works with the liver to make something called bile, which helps you to break down fats. Bile is green. That's why the gallbladder is green. So if I go in and say I've got right upper quadrant pain, they're going to look at my liver. They're going to look at my gallbladder. If I go in saying I have left upper quadrant pain, they're going to suspect it's something with my stomach. If I go in with right lower quadrant pain, I could be rushed into emergency surgery. Why might that be? Why is right lower quadrant pain so potentially dangerous? Exactly. Yeah, several of us are honing in on why it's so dangerous. This little tiny thing right here. This little tiny thing is called the appendix. The appendix lives in the right lower quadrant. It's almost like a finger, or its name is technically looks like a worm, vermiform. So there's this little worm that comes off of your large intestine filled with bacteria. Normally it's no big deal, it's not a problem. But if bad bacteria get in there, it can get inflamed and it can actually rupture. It can burst. And then you've got bacteria all over the inside of your body. Not a great plan. So if I go in with right lower quadrant pain, they're going to check out and make sure my appendix isn't about to burst. So these quadrants help our doctors to diagnose, before they diagnose, if you will, figure out what they might be dealing with. If you've got left upper quadrant pain, good news, it's probably not appendicitis. Right upper quadrant pain, probably not food poisoning. So we can use this to narrow down what we're talking about when we're in the abdominal pelvic cavity. Yeah, so checking out my chat there. People can get their appendix taken out, and they can do just fine. It's actually the same thing with the gallbladder as well. Yeah, the appendix doesn't necessarily do anything for you. It does have some lymphatic system tissue in it, so immune system tissue. But it is kind of one of those things that's just left over, and in humans doesn't really have a purpose anymore. Maybe it did at some point in time, but not anymore. Yeah, just like those wisdom teeth. It's just there and it's fine unless it's crushing your neighbor teeth, right? Then it's not so fine. We got to deal with those. Hey, so Dr. Aulis is going to ask you a trick question, and I'm telling you up front that it's a trick question. Here's my trick question. Which quadrant is the heart found in? Which quadrant is the heart found in? One Hayden says none, or it's not. Yeah, so we're kind of we're chatting it out together in the chat. I love it. When we talked about quadrants, which cavity did we say that quadrants applied to? Where do we find quadrants in? Yeah, it's a long one, right? It was mean for me to ask the question that way, but everyone's absolutely right. Quadrants are found in the abdominal pelvic cavity. When we talk about the heart is not part of the abdominal pelvic cavity. Because of that, the heart is not found in a quadrant. The heart is part of the thoracic cavity. I mean, if we want to get more specific, the heart is in the pericardial cavity. But I can't name a quadrant on the heart because the heart is not part of the abdominal pelvic cavity. So there's my other underline highlight star idea for you. Anything above the diaphragm is not in a quadrant. It's going to be in the thoracic cavity. So it's either part of the pericardial cavity or the pleural cavity, but it's not going to be in a quadrant. Yeah, who found the mind blown emoji? Maybe we need to put that one back in there, right? Rocking your world. So never tell me what quadrants. There we go. Yep. The heart and the lungs are found in. They're part of the thoracic cavity. They don't count. Alex liked my trick question. Thank you. I try. I do my best. I'm feeling a little bit of my coffee kicking in, so that's good. We're making progress. All right. So we've talked about so far organ systems. We have talked about what they do, where we find those organs. We've talked about the cavities. What we're going to move into talking about now is the ways that we might section the organs or parts of the body to help us look at them. So if I go in with any of these kinds of pain to my doctor, they'll probably order some kind of medical imaging study on me. And that imaging study is going to look at different parts of my body in different ways. So before we look at the words that you see here in exercise 6, I'm actually going to go down with you to number 7 down here. So this is a place for us to draw what each of the body planes look like. So I'm going to work with you here with you, do my best with my tools to draw these different body planes. So let's say we go in to the hospital and we think we might be having a heart issue. If I'm having a heart issue, they're going to want to look in the middle of my chest and they're going to want to look at my heart. Let me see if I can rotate. Nope. Okay, we're going to dots. Dots it is. Okay. So they want to look in the very middle of my body, look through the heart from top to bottom. They would use what's called a mid-sagittal plane. A mid-sagittal plane, and in your notes, you can connect the dots. I just am limited here with my tools. Imagine with a mid-sagittal plane, this would be a cut that goes straight from the top of your head, through your nose, through your chest, all the way down to the bottom. A mid-sagittal plane makes two equal left and right pieces. If we're trying to visualize something in the very middle of your body, we would use a mid-sagittal plane to do that. Maybe though, I don't care about the heart. Maybe it's not a heart problem. Maybe I'm having an issue with my shoulder. I still want to look at things left and right from each other, but I don't need to look at something in the middle of the body. If I'm still dividing left from right, but not in the middle of the body, I'm going to do what's called a parasagittal plane. A parasagittal plane is an up and down line, still up and down. We're still making left and right pieces, but they're not equal sizes. Unequal sized pieces, dividing it left and right, parasagittal. Maybe I don't want to do the left and right thing. Maybe I want to divide top from bottom. Maybe I want to go through and look at the digestive system organs, and I need to look at each part of the small intestines to find a blockage. I would use a transverse plane to divide top from bottom. So a transverse plane is when we go straight across, making a top and a bottom. Or in my anatomy words, making a superior and an inferior. A transverse plane, top from bottom. Maybe I want to divide front from back. So if I have a plane that goes straight through the body from the top to the bottom and divides me into a front and a back, or in anatomy speak, an anterior and a posterior, that's called a coronal plane. The way I like to remember that is imagine putting a crown on the top of your head and then making it a cut straight through. Corona means crown. So a coronal plane divides front from back. It's called anterior and posterior, goes straight through the body. But sometimes I'm looking at things that aren't necessarily where a straight line would be appropriate. Maybe I need to go at an angle, and that's what an oblique plane does. So an oblique plane would be what I might use to look at my wrist bones, for example. So an oblique plane, we're at an angle. We didn't go straight up, we didn't go straight down, we went at an angle. Or if I want to look at different structures inside the brain, go at an angle. If I want to look at that ankle joint, go at an angle. So all oblique means is we're not straight in any particular direction, we're going at an angle. So since we have drawn these different planes, I'm going to leave some of this word matching to you. But I do want to emphasize one thing before we move on. And this is the idea that, remember, I can turn things into left and right parts that are either equal, they're either the same size, or they're unequal. They're not the same size. If I'm dividing things equally, I won't make you type the whole word, but what's at the beginning of the word if I'm dividing things equally into equal left and right parts? What does equal start with? Exactly. Yeah. So equal left and right half would be mid-sagittal. We make a cut in the middle, that makes it equal, which means that if we're doing unequal division, that's going to be my parasagittal plane. Parasagittal, not equal. One is bigger than the other. So if we do a straight up and down cut, that's anywhere except the middle of your body, parasagittal plane. When we were talking about our planes, some of the ways that we talked about dividing things, we used some directional terms. So directional terms allow us to understand the relationship of structures to each other. As we're learning these directional terms, this is something that would be really great for flashcards. So if you're a flashcard person, go home today, make your flashcards today for these different directional terms. So the first set of directional terms that we're going to talk about are the terms that mean toward the front and toward the back. So these terms are anterior toward the front and posterior toward the back. The best way for us to learn about these terms is to look at some bones together. So we're going to label some bones and talk about these things. When I look at my skeleton down below, let me introduce you to some bones. This one here in the middle of your chest is called the sternum. The sternum is your breastbone, the central chest bone. I want to compare the sternum to some bones that you can't see very well on the picture. Luckily, Dr. Alice is the nerd who has skeletons in her office. So here's my friend, the skeleton. He broke his arm, poor friend. Okay, so we're comparing the sternum here in the front to these bones along the back called the vertebrae. When I'm comparing the sternum to the vertebrae, I would say that the sternum is in front of the vertebrae. What's my anatomy word for in front of? The sternum is exactly, the sternum is anterior to the vertebrae. Absolutely. The sternum is in front of the vertebrae that are on the back. But maybe the question doesn't say the sternum compared to the vertebrae. Maybe the question says the vertebrae compared to the sternum. Now I would say, oh, well, the vertebrae are behind, or the vertebrae are posterior to the sternum. So here's the deal with these directional term statements. We're going to do some at the end of our lab today. Be very careful when you're working on this on the homework, because when you do the assignment once, the next time you do it, you'll probably get different questions. So maybe one time we were comparing the sternum to the vertebrae, and the correct answer was anterior. The sternum is in front of the vertebrae. But the next time you do that question, it says the vertebrae are blank to the sternum. Well, now we flip-flopped and it's a different word. So the order of the words in our sentence matters. Make sure we're watching the order that they're in. All right, so we've talked about anterior and posterior, front and back. Now let's do a different comparison. We're going to compare the sternum here in the middle to this bone over here in the arm called the humerus. So the humerus is the large bone in this part of your arm here. When I compare the humerus to the sternum, the humerus is kind of farther away on the outside of the body. The sternum is in the middle of the body. My directional terms for toward and away from the midline are medial toward the middle and lateral toward the outside. Medial and lateral. So when I'm saying the humerus is blank to the sternum, would I say that the humerus is medial or lateral compared to the sternum? Is the humerus medial or lateral? Exactly. Yeah, several of us chiming in. The humerus is lateral to the sternum, or vice versa, right? We could say that the sternum is medial to the humerus. So the order matters. We start by deciding, okay, how are we comparing these things? Well, one of these is in the middle, one of these is on the outside. We're going to compare them medial versus lateral. Then we have to figure out which way is correct. Let's compare the humerus that we just worked on to this big bone that we have here in your thigh. The big bone here in your thigh is called the femur. When I'm comparing the humerus to the femur, now the most obvious comparison is that the humerus is above the femur. The femur is down lower. So let's talk about our next set of directional terms, and that's above and below. When we talk about above and below, our words are superior and inferior. Yeah, several of my friends in the chat beating me to it, right? So when I'm comparing the humerus to the femur, the humerus is above or it's superior to the femur. When we talk about the femur compared to the humerus, the femur is below or inferior to the humerus. So above and below, superior and inferior. Where things get dicey is when we're talking about two bones that are both on an arm or both on a leg. So let's go back to the humerus. When I am looking at the humerus, connected to it down in your forearm are bones called the radius and the ulna. The radius is the one that we find on the thumb side of your arm. The ulna is the one that we find on the pinky side of your arm. So the radius and the ulna that I see right here, if I'm comparing these bones to the humerus, I can't use superior and inferior. And here's the reason why. I'm gonna bring back my friend here. When my friend is chilling out here in an anatomical position, the humerus is above the radius and the ulna. But suddenly my friend has a question that he wants answered. When my friend has a question that he wants answered, now the radius and the ulna are above the humerus. So if he raises his hand, superior and inferior are mixed up. The same deal applies to his legs. When he's chilling out normal, the femur is above the two bones that are down here in his leg called the tibia and the fibula. But when he's a cheerleader standing on his head, it's flip-flopped. So when we talk about two bones that are on an arm or two bones that are on a leg, we have to use a special set of directional terms for those. And that's these two right here with the little star. So when we're talking about what's closer to an attachment site, that's called proximal. When we talk about what's farther away from that attachment site, that's distal. So when I'm comparing the humerus to the radius and the ulna, I would say that the humerus is proximal to the radius and the ulna. It's closer to the shoulder, closer to the attachment point. When I start with the radius and the ulna are distal to the humerus. They're farther from the attachment point. They're farther from the shoulder. The same thing applies down here when when I'm looking at the leg. So we've got the femur, and then at the knee joint, we go into the two bones of the lower leg. The middle bone is the tibia, shaped like the letter T. And the outside bone, that's much more skinny or little, is the fibula, like a little fib. When I'm comparing the femur to the tibia and the fibula, I'm referencing back to the hip joint. So the femur is proximal to the tibia and the fibula. The tibia and the fibula are distal to the femur. So keep that in mind when you're comparing things. If we've got two bones on the same leg or two bones on the same arm, that's when we have to use proximal and distal. Otherwise, if we're not comparing on the same arm, we compared the humerus and the femur, we got to use that superior and inferior term. Now there's one more set of words that I want to chat with you about. And I first want to show you why we have to have these directional terms. So I'm going to bring back my friend the skeleton here. When we look at my friend the skeleton here, we're going to pretend that my finger is representing his heart. Now I'm going to ask you some questions, and I promise they're not trick questions. I want you to take them at face value, yes or no questions. So tell me the most blatant answer. So would it be accurate to say that my little heart finger right here, that there are some ribs that would be considered anterior to the heart? Are there any ribs in front of the heart? What do we think? Yeah, okay. Several of us chiming in. Like I said, I promise this is not a trick question. Trick questions will come later. This is not one of them. Okay, so we said there's some anterior. Perfect. Is it fair to say that there are some posterior to my finger heart? Would there be any ribs posterior to the heart? Yeah, several several of us saying yes. Hey, could we even say that there are some ribs that are lateral to the heart? Would that be accurate too? Lateral to the heart? Yeah. Lateral toward the outside, anterior toward the front, posterior toward the back. Here's the deal. The heart is completely surrounded by the ribs. Because of that, I can't use the directional terms I've used before. I can't say anterior or posterior. I can't say lateral or medial. I have a different set of words for when things are completely wrapped around each other. So when I'm talking about the thing that's on the inside, the thing that's getting wrapped up, I call that deep. So in our sentence from before, the heart is deep to the ribs. When I talk about the thing that's on the outside, the thing that's doing the wrapping, I would call that superficial. So when I have one thing wrapped up inside another thing, the term I use to describe those things are deep and superficial. Hey, there is something that is the most superficial thing on your entire body. What's the most superficial thing of your entire body? Absolutely. Yep. So the most superficial thing on your body, your skin. Yeah, and someone mentioned the hair as well. The thing that's on the very outside of your body. So anytime I'm comparing something to the skin, it doesn't matter what I'm comparing to the skin. Anytime I compare anything to the skin, I would always say that the skin is superficial. So the skin is superficial to the heart. The skin is superficial to the ribs, or vice versa. I could say that the heart is deep to the skin. The ribs are deep to the skin. So I only can use these deep and superficial terms when we're completely wrapped around something. Keep that in mind. So I mentioned it before, flashcards with the meanings of these words would be a very good idea. The other thing that would be good to put on flashcards is who's an opposite to who. So on one side, we would have medial. On the other side, we'd have lateral. On one side, superior, the other side, inferior. As long as we learn them in pairs, we are able to order any organs or any bones compared to each other because we know both directions, above or below, in front of, behind, all those kinds of things. I've talked a lot. Let me pause for questions. Yeah, so Jaquandra asked about what's the deepest thing. Yeah, heart, probably deepest. But there's not the same kind of comparison like we made with the skin. We wouldn't always say the heart is the deepest thing. With the skin, we can only ever say it's superficial. So it's not quite the same. But yeah, the heart is pretty deep. It's pretty in the middle of a lot of things. Yeah. Yeah, so Victor is asking about the brain in your head. Yeah, that would be another great comparison to make. When you think about your brain, it's completely surrounded by bone tissue. So yeah, we could say that the brain is deep to the skull bones. The brain is deep to the skin for that matter too, right? Because the skin's all over the entire head. So yeah, great connection to make there. Absolutely. All right, so let's move on a bit here. Because you have those guided outlines and because Google Images exists, I'm not going to go through and label all of the bones of the body. What I am going to label with you, though, are some of the ones that are maybe a little trickier to identify to make sure you get those, and I'll let you label the rest on your own as you're working this week. So we already talked about the humerus in the upper arm, the radius and the ulna in the forearm. Now we're going to move down into the hands. So when we're looking at the hands, you've got a group of bones in your wrist. The wrist bones that you have are what are called the carpals. We will learn in the second half of the semester that all the carpals have their own name, but for now, we're just going to call them the carpals. Your wrist bones are the carpals. Connected to the carpals are the bones that make up your palm. So the long bones that make up the palm of your hand, these are called the metacarpals. Metacarpals. I like to remember them because they meet the carpal bones. So the palm of your hand is where we find the metacarpals. And then the last group of bones that we have in the fingers are called the phalanges. The phalanges are your finger bones. So phalanges, finger bones. The cool thing about the phalanges, which we'll come back to learning their special names after the midterm, is that their names include some of those directional terms we talked about. So proximal and distal are included in the names of the phalanges. Again, you don't have to know them for now, but we will know them later. Yeah, Jessica asked a good clarifying question. The thumb does have phalanges as well. My box didn't quite get it. The thumb has 2 phalanges. All the other fingers have 3 phalanges. So 2, a proximal and a distal phalanx on the thumb. Everything else has proximal, middle, and distal phalanges on it. Yeah, great clarifying question. Those are all the arm bones. Let's review the leg bones really fast. We already talked about the femur that makes up the thigh. We've got the tibia and the fibula that make up this lower part of the leg. Then we go down into the foot. So when we're talking about the ankle bones, the bones that make up your ankles are called the tarsals. So the ankle bones are the tarsals, just like we had the carpals, the tarsals. Next to the tarsals, in front of them, are the bones called the metatarsals. So most of the flat part or the arch of your foot are those metatarsals. And then down at the very front, again, are those phalanges. The little the same name for the finger bones as the toe bones. So the phalanges, the toes, phalanges, the fingers, metatarsals and tarsals in the feet, carpals and metacarpals in the hands. Yeah, Alyssa is asking about some of the bones of the hip. I was always planning to get those, so you beat me to it, Alyssa. When we talk about the pelvis, it actually is made of 3 different bones. So we need to know the locations of each of these 3 bones. Oh, you're totally fine, Alyssa. I'm giving you a hard time, but I love that you're a step ahead of me, so you're good. When you put your hands on your hip, you are touching a bone called the ilium. So the ilium is your hip bone that your hands are resting on your hips. The bone that you sit on when you're sitting down is called the ischium. So, oops, I spelled that wrong. Wait. Ischium. There we go. The ischium, so we can kind of see it, these 2 flat parts down here at the bottom. They're called the ischial tuberosities. That's what you sit on when you're sitting down. And the top of the pelvis is the bone called the pubis. So the pubic region is the top of the pelvis. That's the top bone that we see there. So the pubis on the top, the ischium on the back, the ilium is the one that you touch when your hands are on your hip. There is a question about the vertebrae. I want to actually put that to the class. Can you all help me out? How could we describe the location of the vertebrae? What else might we call the vertebrae? Any ideas? Okay. Yeah, so Cassidy's is talking about where we'd find that spinal cord. Yeah, absolutely. The medial bones. Yep. So when we talk about the vertebrae, these are all of the bones that make up your spine. So we have different groups of them. We'll talk about next week the regional terms for them. We've got some cervical vertebrae, some thoracic vertebrae, some lumbar vertebrae. So all of these bones that make up your spine are the vertebrae. In the very middle, though, in the back of the pelvis, we have this triangle-shaped bone right here. This triangle-shaped bone right here is called the sacrum. The sacrum. So it's at the end of the vertebral column. The rest of these on top of it are all vertebrae, but this big one right here is the sacrum. In addition to learning the names of the bones, and I'll mention we didn't cover all of them on the list. We covered a lot of them, but not all of them. Make sure you know all of them on the list here. We also need to learn the names of the skull bones. The skull has something like 20 different bones inside of it, but the good news is several of them come in pairs. So we learn their name once and we know it everywhere. So the reason we're learning bone names is because next week we're going to learn regional terms, and most of those regional terms come from the names of the bone. So for example, if I'm talking to you about your frontal region, that's going to be by that frontal bone. Or if I'm talking to you about your occipital region, that's on top of the occipital bone. When we're talking about the jawbone, the name of that is the mandible, the jawbone. So the names of these bones are going to help inform our regional terms that we're talking about next time. Lisa had mentioned in the notes that she labeled her bones with letters. The one thing I'll say about labeling it like that is it's not quite as effective of a study tool for you that way. But if it helps you to learn, I don't care. Do whatever works for you. I've just found that generally it's better to label with words on most of the pictures to make sure that it's a helpful study tool when you come back next time. So take it or leave it. I'm not going to grade these worksheets. Whatever works for you is fine. So we have the mandible, that is your lower jawbone. Up above it, and I'm going to switch colors so we can see it. The upper part of your jawbone is a bone called the maxilla. So the maxilla is the upper part with your teeth. The mandible is the lower part. Next to the maxilla, starting to make the edge of your cheekbones, is a bone called the zygomatic bone. The zygomatic bone on either edge here. The top of your head has the bones that are called the parietal bones. So we actually have one parietal bone on each side, two parietal bones. When we look from the side, you can see some of those ones we've already labeled. So the frontal bone, we talked about the parietal bone on the side. We also talked about the occipital bone. A new one that we can see on the side that we haven't seen before is the one called the temporal bone on the side. We already talked about the mandible. We've got our maxilla, that upper jaw there. And it's a little bit weirder to see in this picture, but this diamond shaped thing right here is that zygomatic bone. So the zygomatic bone right there. Hey, not a trick question. What do we think we call the name of the bone that lives in your nose? What do we think this one might be called right here that lives in your nose? Any guesses? Yeah, several of us chiming in. The bony part of your nose is called the nasal bone. The nasal bone. Most of your nose is made out of cartilage. The nasal bone is the place where a pair of glasses would rest. So you can feel it kind of on yourself. At some point you stop being bone and you start being cartilage. Most of the external part of your nose is actually made out of cartilage. So nasal bone up top, and then that cartilage down below. So that brings us to the activity on the last page. And what I will tell you about this activity is that you will definitely have lots of homework questions that are like this. And I'm promising you that you're going to have quiz questions like this as well. These are application questions. So we've learned directional terms. We have learned organs. We've learned bones. Now we need to put all of those things together to help us with understanding the way that things work or where they're found. So I'm going to go through and do about 4 or 5 of these with you, and I'm going to leave the rest for you. In a bit, we're going to split up into small groups to work on a graded activity, but I would also encourage you to consider working on a few more of these statements as well to make sure that we're all on the same page. So let's start with this first one here at the top. So my first statement here says the liver is blank to the small intestine. Now, before we put in our anatomy word, I'm going to go back up here. I want you to give me a normal person word. The liver is what to the small intestine? If you weren't using an anatomy word, the liver is blank. Here's my small intestine. Yeah, the liver is above, right? That's a normal person word. It's above. So my normal word is above. The liver is above the small intestine. So what's my anatomy word going to be? If I'm saying the liver is above it, I would say the liver is exactly. The liver is superior. It's above the small intestine. Perfect. My next statement is talking about the heart and the lungs. So let's go back up here. Here's the heart. Here's the lungs. When we're thinking about our anatomy term for this, the normal person word that we're trying to find one for would be that it's in between or in the middle of. Did I get it? What did I ask about? Is it the lungs? Which order is it in? Dr. Ellis's coffee is falling out. Let's see. The heart is blank to the lungs. Yeah. So we want to say the anatomy word for the heart is in the middle compared to the lungs. What is that word? My anatomy word for it's in the middle of? Yeah, exactly. The heart is medial to the lungs. Now, I'm glad that I got a couple of people that were asking about deep because this is an important comparison I want to make. Deep would be an answer that I might give you half credit for, but it's not quite accurate because see how the heart is not completely wrapped around by the lungs? There are spaces in the front and spaces in the back where the heart is not being wrapped up in the lungs. So the better answer, as opposed to deep, would be medial because there is space where the lungs are not wrapping around the heart. So the heart is medial to the lungs, or the lungs are lateral to the heart. So let's fill in our blank. The heart is medial toward the middle, for our reference, to the lungs. All right, we've done a bunch with organs. Let's move to bones. So the first bone one is the humerus is blank to the ulna. Here's the humerus. Here's the ulna. Both of these are on an arm. So my only options are proximal and distal because they're both on an arm. Yeah, so the humerus is closer to the shoulder than the ulna is. The humerus is proximal to the ulna. The humerus is proximal to the ulna. And let's do this one, our last one here. The patella is blank to the ribs. Hey, we haven't talked about the patella yet. Can anyone describe where the patella is found? Where's the patella located? Exactly. Yep. So the patella is the kneecap. It's the circle bone right here. My patella right here. When I'm comparing the patella to the ribs, I would say that the patella is below or it's inferior to the ribs. Notice I can use superior and inferior because the ribs aren't part of the leg. I'm allowed to use those words. So the patella is inferior to the ribs. Patella is inferior to the ribs. So here's an idea when you're working on these statements. And we kind of tried to do this with some of them where we put those words in parentheses. When you're looking at these comparisons that you're making, there's this idea, KISS. Keep it simple, student. The simplest comparison between two things is the anatomy word we're looking for. When we were comparing the ribs to the patella, the most obvious comparison between the two of them is that this is up higher than this is. Or earlier when we were comparing the sternum to the humerus, well, obviously this is closer to the middle than this one is. So keep it simple. Whatever is the most obvious normal person word that you would use to describe the relationships, use that, but give me the anatomy word for it. I would like to stop talking and give you a chance to type in thoughts or questions or emojis? Let's take a mental break. Thoughts, questions, emojis. Yeah, Alyssa mentioned that the terms are confusing. Yeah, it's going to take practice. I know it's not fun. I get a lot of questions. Students will ask me, "What's the fastest way to learn this?" Unfortunately, there is not a fast way. So we just got to practice with it. Um, keep with those directional terms. Make sure we know what they mean. So learn the English description for them. Um, that'll help you because then you can always start your comparisons with normal person English words. Get to the anatomy words after that, but start with identifying the regular words first. Yeah, I see a couple of questions about or statements about wintermester. Yeah, this would not be a good one to take during wintermester. Also, probably not during the summer, especially not like summer 1. Bad idea. Yeah, a lot of knowledge at once. It's important in this class to really make sure you're studying over time and not trying to cram. Do not put this all off until Sunday night at 9 o'clock when your assignments are due at 11:59. We should be working on anatomy at least half an hour to 1 hour every day. Really try to put the work into it. I promise it'll pay off, but it takes time to learn things. Alexis asked how long I've been a professor. I have been teaching for about 11 years. I've been at TCC for 4 years now. Directional terms and histology, going to be the death of you. Yeah, we have lots of practice resources for histology, but that's another thing. It just takes time. Yeah, Jessica, if you're on a phone or if you're on a Mac, I don't think you have emojis, but that's okay. You can always send me a semicolon and a parentheses to show me if you're happy or sad. That works too. Bernicia, we can chat after class. Go ahead and connect with me. I can give you a recap for what you missed. All right. Yeah, I am making a recording and I will get that available once I am able to upload it places. We would be okay, so let me get here first. The worksheets I don't think are in Visible Body. I think they are just in Canvas. I could be wrong. They might also be in Visible Body, but they're definitely in Canvas. So check Canvas for the worksheets. We would say that the heart is part of the cardiovascular system. Or the other word that you'll see sometimes is the circulatory system, but I believe we have it listed as cardiovascular. Note cards, good idea for learning the meanings of directional terms. Absolutely. Doing the homework assignment is going to be the best way to practice using those terms, but flashcards would be a good way to learn those basic meanings. Absolutely. Lisa is asking about working on the sheets. Again, I think that some people, I will have to touch base with students. I know that there are ways that you can download PDFs and write on them and draw on them because I've had students do it every semester. I just don't know for sure what that way is. So when I know for sure, I will let you know. In the meantime, try to print them so that you can write your notes on them. All right, here's what we're gonna do. I'm gonna go ahead and shut down my recording.